Hello, thank you all for taking the time to watch my presentation today on the psychological benefits of allowing adolescents access to contraceptives. My name is Sarah Filer. I'm currently an undergraduate at Kennesaw State University under the Department of Psychological Science. Upon my graduation this December, I plan to attend a graduate program in order to earn my master's degree in clinical counseling and become a counselor at a residential treatment center for at-risk adolescent female youth. I thought this information was best suited to the American Psychiatric Association, as I'll be discussing the benefits of prescription contraceptives to adolescents, both during their adolescence and into their early adulthood. My intention is to present a compelling argument in favor of adolescents having access to contraception in order to reap the psychological benefits in adolescence and adulthood, benefits such as the ability to practice internal locus of control, contributing to overall psychological quality of life, and reducing anxiety associated with fear of accidental pregnancy. I'll be using research from cognitive, behavioral, and cross-cultural psychology to back this claim. Personality factors such as internal locus of control, self-esteem, and self-efficacy are enormously influential in a sexually active woman's decision to utilize contraceptives or not. A woman must be given a choice on whether or not she is going to utilize her sexual autonomy and take responsibility for it. Which brings me to my first study, a 1992 cognitive study through the Journal of Developmental and Behavioral Pediatrics. The premise of this study was to examine the influence of locus of control on three groups. The first group was women who are sexually active and using contraceptives. The second group was women that are sexually active and not using contraceptives. And the third group were women who are abstaining from sex entirely and thus not using contraceptives. Researchers hypothesized that group one would have a higher internal locus of control than both of the other two groups. They used a sample of 37 women between the ages of 13 and 18 with a mean age of 15 years, 1 month, and a standard deviation of 12 months. 54% of participants were white, 41% Black, and the remaining 5% were Hispanic. Researchers used a self-report method utilizing locus of control scale, Piers-Harris Children's Self-Concept Scale, Stein Future Events Test, and the hypothesis was supported. Group one did in fact have the highest internal locus of control with an average of 27.9 and a standard deviation of 2.28, while group two had a lower internal locus of control and tended to focus and rely more on external or chance locus of control at an average of 21.9 with a standard deviation of 3.24. Now, this study was limited by sample size and a lack of cultural diversity, so it is my hope that in future research, researchers will utilize a broader racial and cultural demographic. The ability to make choices concerning one's bodily autonomy is not only a human right, but a crucial part of what contributes to a woman's overall psychological quality of life, which brings me to my second study, a 2019 cross-cultural study from the Health and Quality of Life Outcomes Journal. The premise of this study was to assess the relationship between common family planning methods and Jordanian women's psychological quality of life. This sample comprised of 548 women between the ages of 18 and 49, with a mean age of 34.7 and a standard deviation of 6.14. All of these women had intermittently used contraceptives for about 5.17 years on average, with a standard deviation of 2. Now, the most commonly used contraceptives by far was the IUD at 41.61%, followed by oral contraceptives at 23.18%, the male condom at 14.23%, and injectable hormones / implants at only 6.2%. Now, injectable hormones can include the depot shot, and implants can include Nexplanon or Implanon. Researchers used a cross-sectional household survey utilizing the World Health Organization Quality of Life, BREF, a 5-point Likert scale used to measure psychological health, physical health, environment, and social relationships. The results of this study showed women using IUDs, injectable hormonal contraceptives, or implants, and male condoms to have the highest social relationship quality of life score, while women who had been sterilized had the lowest social relationship quality of life score, sterilized through tubal ligation. The highest health satisfaction quality of life score was assigned to women using IUDs or male condoms, while the lowest health satisfaction quality of life score belonged to women using oral contraceptives, and again, women who had been sterilized through tubal ligation. Now, it's good news that the majority of women in our sample were using the IUD. This had the highest score for overall quality of life, with 44.3% of women reporting a good quality of life, and only 1.75% of women indicating a very poor quality of life while using the IUD. This study was able to determine a relationship between family planning and quality of life. However, in the future, I hope that researchers will utilize a randomized national survey in order to generalize the study more appropriately. Unintended pregnancy can reap a multitude of adverse psychological consequences, especially among adolescents. Taking action to reduce the risk of unintended pregnancy reduces the fear and anxiety associated with accidental pregnancy in turn. This brings me to my third study, a 2005 behavioral study from the British Journal of Health Psychology. The premise of this study was to operationalize the dynamic contextual model pertaining to emergency contraceptive use behaviors, specifically adherence and non-adherence. This was a convenient sample made up of students within the local vicinity, specifically universities. 824 students between the ages of 16 and 30 were sampled, and a cross-sectional within and between subjects design was used. The between subjects design was used to compare emergency contraceptive users to non-users, while the within subjects design was used to compare use to non-use. Lastly, a questionnaire was used to indicate why the participant took the emergency contraceptive. These reasons could be that the condom broke or that they were not consistent with their oral contraceptives that month. The results of this study showed that users perceiving themselves to be at a greater risk of pregnancy and also associating greater consequences with that unintended pregnancy were viewing emergency contraceptives more positively and felt that their action of taking that emergency contraceptive was appropriate. Non-users reported pregnancy unwanted at a median of 91, while users reported unwanted pregnancy at a median of 93, with a statistical significance of 0.031. Perceptions of vulnerability to pregnancy are a significant predictor of a woman's decision to use emergency contraceptives when it produces peace of mind to her. These studies lend credibility to the importance of adolescent access to contraceptives on a cognitive, cross-cultural, and behavioral basis. Allowing adolescents access to contraceptives not only encourages and allows them to use their internal locus of control, but it also improves their overall psychological quality of life, and reduces any anxiety associated with potential accidental pregnancy. Thank you.